Welcome, and thank you for joining us for this episode, Voices and Choices. I'm Debra Seltzer, and I'm again joined by Beth, Malchus, Stafa, and Dr. Sandra Ortega. This episode will assist you in reviewing your population of focus and identifying your stakeholders. We're defining stakeholders as inclusive of that population you are centering for primary prevention of sexual violence, as well as those who are influencers or providers to that population, and other agencies and organizations who also work with that same population.
Wow, that's a very broad definition, Debra.
Help me remember that we need to get more specific about defining stakeholders later in this episode.
Today's learning objectives are on the slide. We hope by the end of this episode, you'll have a better understanding as to why your community stakeholders need to be a part of your program development.
The first objective is identifying your population of focus. This is the group of people who are the primary recipients of your program efforts.
Secondly, align with other stakeholders who are relevant to the population of focus because they engage with your population of focus.
And we will discuss some ways to engage with all of your stakeholders for program development.
Before we get started, let's take a walk down memory lane to get some history about how we got to where we are now.
Some of you remember Ohio's original Sexual and Intimate Partner Plan, Pathways in Prevention, a roadmap for change, Ohio's plan for ending sexual and intimate partner violence, issued in 2009. To prepare that plan, we partnered with intimate partner violence preventionists and many other stakeholders from around Ohio, and we worked together to collect and review data to establish that 5-year plan.
In that plan, the identified population of focus included all Ohio youth ages 6 through 24, as well as all Ohio men and boys. At that time, youth ages 6 through 24 made up over 1/3 of the population of Ohio. In the 2017 Ohio Department of Development Demographics Report, youth ages 5 through 24 represent only about 1/4 of the population. This change, from 2009 to 2017, demonstrates a decrease, showing the aging of the population of Ohio. However, we continue to identify youth as our primary population of interest, including both the focus on addressing gender norms and socialization of boys and men, as well as inclusion of empowerment for women and girls, as indicated in the STOP SV technical package published by CDC.
As we've said throughout the series, we are learning as we go and we adapt as we learn more about primary prevention. Most of the publicly accessible data we have about sexual violence perpetration and victimization are from 2 sources: police reports that are stored in a system supported at the state level by the Office of Criminal Justice Services, and the National Household Survey conducted by CDC, the National Intimate and Sexual Violence Survey. We are more than aware that these data are limited. However, we know that we have to start somewhere in order to frame our understanding of sexual violence in Ohio.
In the 2015 Sexual Assault in Ohio report, the Ohio Office of Criminal Justice Services, or OCJS, provided information about the suspects for whom the demographic information is known. The report found that 93% were males. While the average age of the suspect was 31.7 years, 44% of the suspects fell within the age range of 12 to 23 years. The average victim age was 18.9 years, and approximately 30% of the victims were between the ages of 12 to 17 years old. This data supports the selection of youth as the population of focus for Ohio's strategies.
Each local program should identify and review any local available data, as well as the agency and community assets and needs assessments. We'll be discussing more about community assessments and available data in episode 6. Using this data helps identify your population of focus and provides additional defining characteristics of your population of focus, such as stories about how the community overcame problems, or specific geographic or settings to your focus of your strategies. The more you know about your community and the individuals who live there will help you better focus and define your work.
So Beth, is the data from OCJS available locally? And if so, how would one of the grantees go about getting that data?
That's a good question, Sandra. I think yes, it is available locally. And if one of the grantees wants to get the data, they can contact OCJS. Or if they have a relationship with their local law enforcement agency, they could request it from them. Because all the arrests in their county or location are reported to OCJS.
Okay, thanks, Beth.
We are seeking to ensure that the work we're doing to prevent sexual violence aligns with other work being done in Ohio. Ohio has a State Health Improvement Plan, or SHIP, which is revised every 3 years. The SHIP process starts from a State Health Assessment, or SHAW, and is then developed through broad statewide stakeholder input. Our work is most directly connected to the current SHIP through our work to address the community conditions of adverse childhood experiences. Each county does its own community health assessment, called a SHAW, and Community Health Improvement Plan, or CHIP. You should be familiar with your local plan, and ideally, participate as a stakeholder in the effort to develop that plan. We'll talk more about these in the next episode.
So would the grantees have access to the community health assessments and the community health improvement plans? How would they get those?
Well, they should have access to those two reports. The local health department is the lead in each jurisdiction to conduct the assessments and create the CHIPs.
Oh, okay. Thanks, Debra. That's good to know.
We are currently working on a new state sexual and intimate partner violence prevention plan. Information on how you can get more involved with and learn about this work will be coming soon.
Our program unit at ODH also coordinates to align our work with other programs within ODH, as well as with other state agencies and other state organizations and coalitions on statewide prevention plans for related fields. We know that many of you are also involved in those types of efforts in your communities.
It sounds like there are a lot of great options on looking at existing data to help hone in our work. I wanted to also mention that CDC provides guidance on various data sources available to us, and we also learn from the lessons shared from others doing similar work around the country.
The more you know about your population of focus's characteristics, the more you can build off their assets and tailor PPPs to what they need. It's essential to know basic demographics, including social, cultural, and linguistic backgrounds, what crime or public health data shows, but it's also important to understand the assets within the community. This means listening to the community's histories and stories around sexual and gender-based violence and understanding what they care about and what skills they bring to create change in their community. In doing so, you are creating a relationship with your population of interest. You are working together.
So looking at all of the resources within your communities that address the risk and protective factors and align with sexual and gender-based violence is equally as important as looking at the sources of data that we've mentioned.
Yes, and building relationships with community members that hold community's history is so important because this information is not in the publicly accessible data sources.
By building these relationships, you can develop a plan that is focused and tailored to the population you will be working with and identifies the key factors that you need to evaluate.
Okay, so let me get back to what we're required to do for CDC. For the CDC proposal on our statewide impact, we were asked to narrow the scope of our work. For the current cooperative agreement, which is through January 2024, we identified the following populations of focus: youth and young adults, men and boys, adults who are working with youth and young adults, systems that youth and young adults come into contact with, such as workplace, after-school activities, communities of faith, schools, mental health care, and governmental agencies.
These are the populations that we have prioritized to work. We would like to do more to engage directly with representatives of these populations, and we would like your help to do this. Many of you are mentoring youth-led councils or active in local associations that are increasing protective factors. We've been learning from you. And at the state level, we are working to identify what are the gaps, what are the assets, and how we can work with the population of focus to make changes in our state.
These are important ideas we all need to keep working on. We're seeking to partner with all of you in engaging with the populations we have prioritized on working with them to invest in their community and come up with solutions to these problems. Including members of the population of focus and planning is something we are seeking to do more and better. This is not a new concept, but we need to keep getting better at actually doing this.
All of you are working with youth. In recent years, we've asked you to narrow your focus. Everyone should be working with a specific age range within the scope of youth. For most of you, that is the high school students. For some of you, that may be middle school youth or college age youth. You should be able to articulate your reasons based on data that you selected the age and range and setting in which you are focusing.
In the handout for this episode, you will find some of the specific types of communities or populations you may focus on, as listed in the reporting forms to CDC. It's okay to address the general population, but if you can narrow the population, that can increase your effectiveness.
For those of you in more rural areas, it may be realistic to reach all youth within the age range you have identified in the geographic area you serve. However, within the work you do to include leadership by and representation of youth, it is crucial that you ensure the diversity of your community is represented. Every community has diversity. It may be race, religion, economic background, sexual identity and orientation, ability, and even where in the geographic area they live exactly. Be aware of gaps in representation and how you can reach and recruit new participants.
For those of you based in more urban areas, there is even more work needed to ensure you're intentional in where your work is focused and how youth are represented in your efforts. Be cautious of focusing programming just because that is where you are invited, as those are often places that already have more resources. Start from the data about need and where you can have significant impact on the risk and protective factors we are seeking to change. We suggest you pause the episode here and take some time to answer the questions on this slide, which you can also find in your handout.
Now that you're done with the exercise, as you continue to narrow population of focus, you will want to be sure that your efforts are also inclusive of a full range of diversity within the population of focus. You will want to work with your stakeholders in your planning process to ensure this diversity.
So Beth, can we talk about the different stakeholder groups? That's an area that often confuses me.
Sure, Sandra. CDC discusses stakeholders or partners in 3 categories. Your primary stakeholders are the people who stand to gain or not gain from implementing the PPPs. We've been using the term population of focus, which is the same as the primary stakeholders in the slide. This would be looking at members who fall into your population of focus: youth and young adults, men and boys, and adults who are working with youth and young adults. As we discussed, these are the people often missing from your coalition and advisory committee.
Secondary stakeholders or partners are those who are directly responsible for the primary population. I would say these folks are commonly sitting on our coalitions and advisory committees. For example, when your population of focus are students, you'll be working with the school staff and administrators, coaches, parents, and other adults who work with those youth. They're probably the most obvious choices for partnering and/or engaging because both you and they see them as connected to the primary population. There are also other partners in your community, such as drug and alcohol prevention providers, healthcare providers, faith based organizations, after school or other club activity providers, who you may also work with in reaching these students. It's fine to have PPPs directed at those others, but with clarity that that programming is aimed at addressing risk and protective factors of the students.
Finally, key stakeholders are less obvious, and often you may have some more work to find them and get them to the table. For example, a school board member approves prevention curriculums and how policies are implemented. Influencers are also part of this group. It could be a community leader who's not elected, such as a baseball coach or a local business owner.
And in this day and age of technology, an influencer could be a young adult or teen who's a TikTok influencer. I've heard several RPE preventionists are working with these influencers to create messaging.
Having effective partners representing all three stakeholder groups is important for advancing RPE prevention and for making advances in racial justice, equity, and inclusion. These partners help shape a strategic plan by working with you to help choose PPPs that will fit within their community and be sustainable.
Including the primary stakeholders, population of focus, such as a teen advisory council, has been really successful in ensuring the strategies and activities are relevant and implemented.
I've read many grant proposals. Most partnership engagement only includes secondary stakeholders and don't necessarily engage with the key stakeholder. For example, I see many grant proposals working with schools, hospitals, drug and alcohol councils, Boys and Girls Club leaders listed as partners. Or they bring in organizations or community programs that are working on the same risk and protective factors.
By doing so, they may be missing key stakeholders who hold influence within their communities, like those folks previously mentioned.
I think this goes back to my point. By missing these voices, you may end up choosing a PPP that doesn't necessarily fit for the population of focus.
And most importantly, checking those who are at the table to make sure they represent the diversity of your community.
So Beth, what do you think are some ways to engage those populations of focus?
There are two important ways to involve people. First, you can listen to them so you have a better understanding of the issues that they're trying to address and the barriers that they are trying to manage or prevent around the issue, and their ideas for how to address the issue.
Second, they can become involved through participation in the initiative or program that is being developed by helping empower them to confront the issues. It's always better for people to participate, but if those affected are not able to for any reason, such as not having time, listening to them is a good way to start building rapport with them.
There's a lot of responsibility inherent to convening stakeholders, especially those who may not traditionally have been invited to the table. It's critical to ensure that they are respected and valued and heard. One way is to invest time in training yourself and your colleagues in how to best facilitate these conversations. It can be a good choice to hire an expert facilitator to moderate the process.
I have sat on several strategic plans when ODH has brought in an outside facilitator. For example, for the State Health Improvement Plan, ODH contracted with the Health Policy Institute of Ohio to facilitate assessment, listening sessions, and data analysis of the plan.
I've worked on several state and local work groups. I've seen a lot of harm done when the leaders don't take time to build a relationship among members. Listening and trust building sessions need to be built into the agenda. And here's something else to consider. As we are using a racial justice, equity, and inclusion lens, I think we also need to reflect who gets to define community, whose voice is at the table. Sometimes people are wearing different hats. For example, the school board member may also be a parent, or a person who is Latinx and also representing the LGBTQ community might also be there.
Take time to be sure that there's a broad representation. Ideally, multiple representation from different communities to ensure people are supported in their role. Check with groups to see if they can think of anyone who is missing. The goal is to let the community decide what they want and what they think will work in their community.
Working with communities, especially elevating voices who have lived experiences, means stepping back and listening. It means working humbly, shoulder to shoulder. It means recognizing the agenda and solutions don't lie with you, but with the community you are working with. It also means paying people and teams for their knowledge and experience.
You bring up a good point, Sandra. Many times we are showing up and are paid for this work when our community members have been asked to be there and offer their knowledge for free. It's an unfair practice that some of us at ODH are talking about. We are currently looking at creating deliverables to change this practice. Change in practice should not only happen at the local level. At ODH, many of us are really trying to shift our culture. Paying people fairly for being at the table is one way.
Yes, I've been reframing the way I think about community engagement and using the term co-creators, which is really a much more accurate term if we think about the work we need to be doing in order to build community.
Changing an organization or a system culture and practice is hard work. We can't look the other way, even if it is hard, scary, and overwhelming.
I think working humbly is also owning up to your mistakes and knowing when to step back.
It is working with the community compassionately and recognizing their collective knowledge. It's how you rebuild trust. And I think it's also means letting folks know that everyone has something to contribute to the work. I know for me, it's also letting people know that I definitely don't have the community knowledge that they hold.
Now that we have talked more about the range of stakeholders that you may have, go back to your strategy maps and take some time to answer the questions on this slide, also found in your handout.
Now that you have taken some time to think about your stakeholders, you might notice some who have been missing from your table. Make plans to reach out and involve those missing stakeholders. You will want them engaged by the time you get to the next round of needs assessments and strategic planning, which we will be talking about in future episodes.
Remember, the first step is being invited to the table, and that may be the easiest step in community collaboration. The critical component is ensuring all who are invited continue to feel welcomed and heard. We shared several tips for helping with making sure the members feel welcome and their voices heard, because after all, they hold the community knowledge and will be in their communities long after your project is over.
This slide lists resources we have referenced during this episode. These and additional related resources can also be found in the handout to accompany this episode.
Thanks for tuning in to this episode on using continuous quality improvement or CQI process for our prevention work. Remember, we're here to support you, so if you would like to schedule an individual TA session or just bounce ideas off of us, contact us and we'll be glad to help.
Please remember to complete the evaluation for this episode so we can continue to improve them.
A special thank you to Jasmine Barfield for her techie and blogger expertise, which has helped us use a different learning platform. We are very grateful.